of the entire summit is all about breaking down silos and connecting to the human experience. And I thought I would start with a quick story about my first experience with silos. Now, it may not be the most profound, but I'm guessing that everyone here has a story like it. So back in high school, yes, we're going there, when I was trying to figure out, just like every high school student does, what to do with my life, I figured, I really like art class. I love drawing, I love painting. I think I'll go to art school. And my mom, being a responsible mother, looking out for the livelihood of her daughter, said no. But I had a very wonderful art teacher who also had a career in advertising. And so he said, maybe you should consider advertising. And I thought, that's cool. I do have an ad posted on my wall right now at home. And this was it. Barry Sanders, late 90s, pumping up the air cross trainer back in the day. Well, I was an athlete, and it spoke to me. It said things like, write a letter to the editor, travel to a foreign country where you don't know the language, do a triathlon, throw away your television. But the words that really were the ethos of Nike and Just Do It were these. Too often, we are scared of what we might not be able to do, scared of what people might think if we tried. We let our fears stand in the way of our hopes. We say no when we want to say yes. We sit quietly when we want to scream. And we shout with the others when we should keep our mouths shut. Why? After all, we do only go around once. And there's really no time to waste. So I went to college in advertising. I went to the Newhouse School at Syracuse University. And in 2014, Oprah Winfrey ceremoniously opened up Newhouse 3, a center for digital media there at Syracuse, really bringing technology into the communications field. And mostly I wanted to make sure Oprah was here today, because I did call her and she was busy. But we got Dan Heath, and he was pretty amazing. So we'll look forward to that in 2022. We'll see what we can do. And I'll be told, this is what it looks like in Syracuse University today, right now, which is also why you're all here in sunny San Diego. So I majored in advertising, and to be honest, it was great. I loved it. But I did get kind of bored. I remember one particular assignment where our advertising professor said, you need to go and sell some paper goods and some office supplies. I need you to create an ad to sell highlighters and pencil erasers. And I kind of said, well, that feels a little pointless, right? So I was bored, and I thought, maybe there's something else I can do with my time. And so I took a Policy Studies 101 class. This was all about learning about private-public partnerships and how you could actually have an impact in the world. And I had a professor who would scream at us, what are you going to do with your life? Are you just here in college to party? The short answer was no, but he required all of us to actually go out into the community and do things. So I volunteered at a local parks department, and I spent after-school time with some kids who actually didn't have anywhere to go after school. It was a broken-down trailer in an empty lot. Our heater was broken, but I'd hang out with them and make sure that they had food and a safe place to be after school. I went to city council meetings, and I also went and trained some of my advertising colleagues to make ads for organizations like Meals on Wheels. And it actually was a really incredible opportunity experience. And so I double majored in advertising and policy studies. Seemed like a good thing to do. I was learning about the power of communication, how to hook people with emotion, and how to communicate with meaning. And I was also learning how the real world worked. And my senior year, I wrote a thesis on Nike, because I did have that poster on my wall after all. But this was the catalyst for it. Take a look.
If you let me play.
If you let me play sports.
I will like myself more. I'll have more self-confidence.
If you let me play sports.
If you let me play.
If you let me play. I'll be 60% less likely to get breast cancer.
I will suffer less depression.
If you let me play sports.
I will be more likely to leave a man who beats me. If you let me play.
I'll be less likely to get pregnant before I want to.
I will learn
what it means to be strong.
To be strong.
If you let me play.
Play sports.
If you let me play sports.
So education, early pregnancy, maternal health, domestic violence, all issues that we in public care deeply about. But this was 1995, and this was groundbreaking, and this was not a PSA. And there was a paradox to these words, advertising and social responsibility. It was almost like they weren't allowed to coexist. Ironically, just about the same time, the Social Marketing Quarterly was coming into its own. I didn't know what social marketing was, and none of my advertising professors did. Nike arguably created one of the best social marketing ads of the time, and I'm sure that they didn't know it either. If anything, they called it cause marketing or CSR. My thesis was Nike, the role of advertising and corporate social responsibility. Again, looking at that paradox. And we are proud that we're going to be partnering with Social Marketing Quarterly as part of Agents of Change to publish a special edition featuring many of the practitioners who are here today. Susan Kirby, who is the assistant editor of the Social Marketing Quarterly, said she wanted to make sure that it wasn't just academics that got published, that practitioners doing the work on the ground could also see their work in print. And I have to take a moment here because sadly, Susan passed away in her sleep a few weeks ago in December. And she was a really bright light. She was a bright light for all of us in social marketing. And so I wanted to take a moment as a connector that she was to ask each of you to introduce yourself to someone that you do not know sitting next to you. Say hello and tell them the work that you do. And so as I've talked to many of you over the past few weeks preparing for the summit, and as I've talked to lots of you over the past day, I've heard this theme of silos come up again and again. And look, we just broke down some silos just there. We did it. My boss won't accept my data. They won't listen to my presentation. I don't have enough funding. I even had a conversation, a wonderful conversation with someone yesterday in communications who's going back to get her PhD in public health because no one will listen to her point of view. The thing about silo breaking is it doesn't always feel that way. Creating change doesn't feel heroic. Sometimes it's just the logical next step for a project. Sometimes it happens when an outsider comes into a new department or a new space and has a different point of view. And sometimes it just happens because there's plain old no other alternative. In companies where they're going through a crisis, oftentimes one of the root causes of major issues in an organization is this thing called a silo mentality. Groups that do not share information, goals, tools, priorities, ideas, and processes with others. And it's proven to impact operations, reduce employee morale, and it may contribute to the overall failure of a company, a product, or a culture. This is the same in public health, and we all know this. We have no time to waste, and we have no opportunity for failure. So I thought I would share some examples of what I realized in retrospect may be small opportunities towards breaking those silos. But just think if we multiplied these opportunities, how much we could change our space. Advertising and policy, social marketing and technology, behavior change and social impact. Let's erase those silos and invite everybody to the table because we have a lot of problems to solve. My first thought is to share this idea of building brands together. One of the first things you learn in marketing is this concept of brand equity. It's the additional value a product receives from having a well-known brand. It's the difference in the price that you pay for a brand versus the generic. And it's the reason why when I was an intern at the Parks Department in Syracuse, a little kid named Jerome, who was the funniest kid I knew and would make me laugh every day, was made fun of himself for his sneakers. They weren't Nikes. Now in California, we have a really brave client, the California Department of Social Services. CalFresh is the brand for nutrition assistance in the state. It was established in 2010, but no one knew that. They called them food stamps, EBT, SNAP, and the adoption of benefits across the state was lower than it should have been. And the challenge with that is that it also had the potential to affect funding. And so the logo had changed, but people who were out there providing services on the ground to people who needed them didn't really know how to communicate to them. So not only did they have to do the outreach, the technical assistance, sign people up for these benefits, make sure that they followed up, but they had to figure out how to get people in the door in the first place, right? And this is what the brand landscape looked like for the state of California. So dollars were being spent across all of these programs to create materials, to promote them, to get people's attentions. All of these programs had evidence-based curriculum. They were founded on the principles of public health. They were, in and of themselves, good programs. But the value of the dollar was so weak. The program managers across the state were doing back-breaking work, but it was never enough. And in the meantime, our competition in the nutrition space was a brand master. Now, can you imagine if McDonald's had asked every franchisee to take the golden arches and start selling burgers? What would happen if every franchisee had to create their own materials, had to create their own commercials, had to create their own staffing plan, their own pricing, their own products, their own promotions? If we were in charge, we would have had McDonald's salads a lot earlier, wouldn't we? So this was a really big challenge, and California said, you know what? We need to do something about this. It's important to the people in the state who need nutrition assistance, and it's important to all of our partners across the state who are doing this backbreaking work. And so what we did with them is create what we call a social branding system. It's an integrated system of branded programs that's designed to communicate and fulfill relevant promises to drive positive behaviors. It's a way we were able to apply the theory of brand to the public health space. And after a year of work, when I'll have to admit, at the first meeting, we sat down with a few of the state implementing agencies, and one of the gentlemen, the head of the state implementing agency, he looked me square in the eye and he said, "How are you going to get us all to agree?" Well, that was a really good question, right? And I looked back at him and said, well, it's really not about us. It's about figuring out how we can create more value than we, quote, take away by creating a unified brand. How can we make their jobs easier versus harder? And how can we create something that ultimately has equity we can build on over time? And so this is where we ended up. Today, this is what the brand family looks like. Our local implementing agencies all across the state have a unified look and feel. Materials are created just for them with an opportunity to add their logo, and they don't have to create things on their own. They get more support. There's a toolbox for them. They can pull out the tools, create their communication materials, and know that they've got an entire state of materials that are working towards them, and people will recognize things in multiple places. And at the launch meeting for the local implementing agencies across the state about a year ago, after the keynote, the project received a standing ovation. Here's what they saw, and more importantly, think about you as an individual or that client you have seeking nutrition assistance and how they were able to see all of the support that was around them in the community because all of these programs were branded together.
We all work towards the same vision, to improve the health and lives of people in our communities. We strive for a California where everyone is active, healthy, and nourished. Our programs and services address the needs of the whole person, and how we show that matters. So meet the new CalFresh, a family of services united under one brand identity. So when someone sees us at the store, at their child's school, at the food pantry, when signing up for benefits, watching TV, or visiting our website, we make it clear we're CalFresh, supporting all of California, one family at a time. Learn more at calfreshhealthyliving.org.
And so what we were able to do is connect the dots for consumers out there in the marketplace, for our clients who needed help. And ultimately what we did is build capacity for healthy communities. The social marketing connected to the policies, systems, and environment support that all of our local implementing agencies on the ground were providing. And we created a statewide brand that everyone could see and understand that built brand equity on itself over time. If you have a new funding stream or a new project, before you go out and have that instinct to create a new logo or to create a new name, look around you and see if there's someone that you can hook your wagon to. And next, it's important to think creatively about funding. So the amazing thing about our work in public health is that we are not in competition with one another, right? Or at least we shouldn't be. Unlike Nike and Adidas, we are not competing for market share. Collectively, we are trying to reduce tobacco use. We're trying to educate mothers. We're trying to help people kick substance addiction. Because of this, we can share resources in ways that commercial brands just simply can't. And we need to use that advantage for ourselves even more. One opportunity for all of us is to think about funding partners. In 2018, Tobacco Free Allegheny in Pittsburgh came to us and said, we'd really like to do something for our teens who are in rural communities that are at a higher predisposition to tobacco use. Here's how much money we have. And the short answer was it wasn't enough to do an effective campaign. But in working with the Pennsylvania Department of Health and working with Adagio Health, pulling in a new partner who was also looking at risk profiles of teens in their communities, and the Erie County Department of Health, we were able to create a contract and an opportunity for all of them to pool their funds and create a comprehensive program that covered the entire western side of Pennsylvania. And what this did was give each of them an opportunity to make sure that they could cover one of their priorities, but they didn't have to shell out the dollars entirely on their own. Now, last week I was at a conference for First Five in California, and there was a woman from early childhood Orange County who literally had a slide up there that said, if you're looking for maternal health support, child care support, she's like, call local businesses, call the local hospital system. I've found ways to find funding. Pick up the phone, send them an email, and see what you can do. It was brilliant. And she was so excited about it, and I was so proud that it was coming from an organization who'd experienced success in the past. Now, it was wonderful for us to be able to connect the dots for these folks in California, and I wanted to show you a very tailored and specific message that they were able to deliver to a priority population that they probably wouldn't have been able to effectively talk to if they hadn't come together and thought about funding differently.
My family has a deep legacy around here, and we look out for each other. My folks and their relatives, my aunt and the little ones, even grandma down the way. We got each other's backs. Even when it comes to my little brother, he's really something, but he's one of the reasons I live tobacco-free. Because if I use tobacco, my little brother is more likely to use it too, and that can cause him cancer down the line. I can't be the reason he does that. So for my family, I live tobacco-free.
Go to downanddirtylife.com/lookingout.
Next, invite others to your party. So as part of our work in California, and frankly every other state, we work with all these different agencies, nonprofits, partners, right? And we want to leverage that on-the-ground support. But so many times we have partners, grantees, who no matter what we do, how many times we explain them something, how many webinars we create, that our grantees just won't do what we ask them to do. Anyone have partners like that? Well, in the words of Elsa, I want us all just to let it go. Because it's not just enough to invite them to the party. We have to find the right people to invite to the party, and we have to make it really easy for them to participate. Now, I'm going to share an example of a breakthrough moment for McDonald's when they really realized they were in a different business than they thought they were. Anybody see the movie The Founder, the story of McDonald's? Minuscule revenue stream, no cash reserves, and an albatross of a contract that requires you to go through approvals that never happen. Sound familiar? Mm-hmm. So early on, McDonald's realized that they weren't just a hamburger joint, they had locations. But I want to share some math with you that I've done. So when I was doing work with the National Parks and Recreation Department, I realized that there are 10 parks for every single McDonald's. Point for public health. We win on land. We win on the number of locations. Public health sites. We have an army and a resource of opportunity just in our communities to connect with people in a way that can help improve public health. And so in our work with California, we looked at things in two ways. We look at things not only from the media standpoint in terms of the number of dollars that we have, but we look at building capacity by growing our network, right? And making sure that we can connect the dots with organizations that are hand raisers, that want to participate with us. And we also make sure it's really easy to invite them to the party. If they're not interested, you know what? That's okay. We know that someone else in our community is going to help us share the nutrition education message that we're looking to create. We invite them to sign up online. We give them a box with toolkit of materials, and we create a healthy day all at once where everybody can participate. And we celebrate Healthy Snack Day every 2 years in August. And it creates an opportunity for us to get everyone together and create a mobilization of our community. And in 2 years, we've had over 678 events with 190 organizations across the state, with 80% participation of counties across the state. Urban, rural, suburban, all of them. It's been a smashing success, and they all are excited when there's another coming their way. Invent and crowdsource. So sometimes in public health, the funding or the opportunity really doesn't just come our way. And we are left watching a problem grow when we know we could do something about it. And this is something that we saw at Rescue when we've been doing focus groups for years, and we've seen vaping come up among our teen audiences again and again. And so we said, instead of waiting for all of our tobacco control partners or the states to figure out how to actually get funding through, let's create programs and communications that are evidence-based, that are proven, that we do research around, and make them available when the funding finally does come. And so we created Behind the Haze, which is currently running in 11 different states, to address an urgent need. Virginia started out the charge, and the content has been licensed in multiple states, and we're able to create a roadmap for the products that we're able to see in the future. All of these commercials are evidence-based, they're tested, and we can be confident that we'll be ahead of the curve when there's an opportunity for funding in their state. In Philadelphia, we got a phone call from the mayor's office in the Philadelphia Department of Public Health, and they said, the mayor wants to do something. This was in October when all the headlines were breaking. They said, can you help us? And we said, yes, we've got this program, Behind the Haze. We can help you run some commercials very quickly. Here's the research. You can take a look at it. You can see if it's useful for your organization. And within 3 weeks from that phone call, they had a press conference. And the mayor was able to say, we're addressing this urgent issue in our city. We're going to do something about it. And today I'd like to show you one of our latest ads, because also in October when those headlines were happening, we were hearing from teens about those headlines, curious and interested in what does this mean for them. So we took those headlines and we created a campaign. The lung damage that we'd been hearing about on television and in the papers turned into a commercial that put a spotlight on the health consequences of vaping. Take a look.
The lungs have a foamy-looking appearance. There's a chemical burn in the airways. The injuries look like those seen in people exposed to poisons like mustard gas. I'm actually not talking about war. That's how doctors are describing what they see in the lungs of vapors. The chemicals can essentially burn your lungs. Find the truth about vape's toxic chemicals at behindthehaze.com.
From headlines to research, to formative testing, to production, and through that whole process in less than 3 months. And so this is reshaping and reframing the opportunity to create a campaign and get it to market. And it's important because the public health issue is not going to wait for our funding streams to catch up. And my last thought to share with you is really to make sure that we are engaging young voices. It is incredible what can happen when you engage young voices in a conversation. And it is very difficult for decision makers with eye contact and a strong handshake from someone in their community who really cares to not listen. In New Mexico, we've been working on a campaign called No Minor Sale for 3 years. At points in time, it felt hopeless. It's a state that has preemption. We were often asking ourselves, why are we working on creating urgency or creating education around licensing laws when the state has preemption? They're never going to be able to pass anything at the local level. Well, right now, in New Mexico, our youth are meeting with legislators, and the tide has shifted. They're moving towards creating statewide legislation that addresses tobacco licensing in New Mexico. And our students are poised and ready to have those conversations because we've been doing that work for over 3 years. A few weeks ago, I went to a conference up in San Francisco. It's called the JP Morgan Health Conference. It was an effort to push myself out of my comfort zone and actually think about other silos, other people talking about health. And I was at a panel talk, and I was introducing myself to a gentleman who said, well, what do you do? And I described it, and he said, wow, that is the most meaningful work. Well, I looked, and he said to me, you know, health is wealth, right? We should be measuring the GDP of our country based on the health of the community and the people that we serve. Now, I looked him up when I went back to my seat. He was the head of one of the largest health systems in Los Angeles. And I thought it was very ironic that he was sitting here saying health is wealth. By the way, Ralph Waldo Emerson also said it when we were at the biggest banking event of the year. But what I take from this is this charge, this call to action that all of us, all of you, have the opportunity to affect the most precious resource and the most important job in our communities to impact our health. Because without health, we really have nothing. It's amazing how quickly everything else falls away when we don't have our health. And so again, recount the ethos and the thoughts of Nike. Let's get out there and just do it. Thank you.